Sometimes, when a child or young person has a special educational need or a disability, the support which they are already getting in nursery, school or college is not enough. If this support is not fully meeting their needs, you may apply for something called an Education, Health and Care Needs Assessment.
This is an assessment completed by the Special Educational Needs and Disabilities Assessment and Review Team, SENDART, to determine the needs of your child or young person and the support they may require to be able to achieve their aspirations and outcomes in education. Anyone can apply for an Education, Health and Care Needs Assessment. You can do this by contacting your child's educational setting or by contacting SENDART directly. You can find information about this on the East Riding local offer or by contacting the Special Educational Needs and Disabilities Information, Advice and Support Service, SENDIAS.
The assessment is split into several stages. Once a request is submitted, a member of the team will acknowledge this within 2 working days. Within the first 6 weeks, SENDART will use the information that you or anyone who works with your child or young person have submitted as part of the request to determine whether or not to conduct an assessment.
This is based on whether the information provided suggests that your child may have special educational needs or disabilities that may require special education provision. During this time, you will be contacted by an Education, Health and Care Officer, an ECHO, who will explain this process in more detail and answer any questions you may have.
You'll also be asked to complete a medical questionnaire and submit your views as well as the views of your child or young person. It's important to remember that you and your child or young person will be fully involved throughout the assessment process.
If we feel that an assessment is needed, you will receive a letter explaining the timescales for the next stage of the process. The ECHO will contact you again and requests for advice will be sent to professionals in education, health and social care who may be working with your child or young person.
You'll also have the opportunity to request advice from any other services that you deem to be relevant to your child or young person's education, health and care. Examples of medical professionals include consultants, therapists, specialist nurses and health visitors. Other professionals include specialist teachers, tutors, social workers or portage workers.
If a professional working with your child or young person is requested to submit a report as part of the assessment, they are legally obliged to do so within 6 weeks of the request being issued.
During the assessment, you will be contacted by an educational psychologist, often shortened to EP, who will visit your child or young person and provide recommendations following their observations. You will receive a report from the educational psychologist.
Within 16 weeks of the initial request being made, the local authority will have completed their assessment and will decide whether an Education, Health and Care Plan, an EHCP, is necessary for your child or young person. The ECHO will contact you around this time to explain their decision and the next steps of the process.
If it's agreed that an EHCP is required, you will receive a draft copy of this plan within 16 weeks of the initial request. At this time, you will be able to inform SENDART of which schools you wish to be consulted for your child or young person to attend.
You will have 15 days to make any suggestions or comments regarding the draft plan, and you can request to meet with your ECHO regarding the draft plan if you have any questions. SENDART is required to finalise the EHCP by no later than 20 weeks following the initial request for assessment.
If at any stage of the process you disagree with SENDART's decision, you will be provided with information on how you can challenge this and seek support from SENDIAS. It is important to remember that even if we do not agree to issue an EHCP, the assessments conducted will provide valuable information for people working with your child or young person to use in practice.
The EHCP is a legal document that must be followed. This is why it is important that the plan must be really clear in detailing what your child or young person's needs are, what support they should receive, who will provide this support, and the frequency with which the support will be provided.
The ECHO will work with you, your child or young person, and the professional supporting your child or young person to set long-term outcomes that recognise their aspirations.
One important thing to check when reviewing the draft plan is what is known as the golden thread. This means that for every need that your child or young person has, there should be a corresponding provision that meets this need, and an outcome that shows what will be achieved by providing the provision. This should be linked to your child or young person's views and aspirations. The EHCP must be reviewed every year. The local authority requires the educational setting to hold this review, and they should communicate regularly with yourself and the ECHO if there are any concerns or changes to your child or young person's needs, so that the EHCP accurately reflects the provision that they require. Throughout this process, your ECHO will be your main point of contact. Their details will be shared with you, so you know who they are and how to contact them if you have any questions.
You may also contact Send Inquiries and speak to one of our team members, who can provide useful information and will be able to answer the majority of your questions.